Today, I'd like to discuss another very common question from patients, or that patients have, and is, do I have a pinched nerve in my back? Oftentimes, people present to the office or at home. They have excruciating pain in the center of their back, and due to the amount of pain, assume that it must be some kind of pinched nerve. So today, I'd like to discuss the answer to that question with you utilizing that anatomical model. This is an anatomical model of the lumbar spine, and this is looking at the spine from the side. So if I stand and I'm standing like this is the front, where my belly would be here. And then when I touch my back and I feel those bony protuberances in the center, I'm actually touching this part. They're called the spinous process. There are about 2 or 3 inches of muscle for most people that then overlie these bones. This portion of the bone is called the lamina, which many people have heard of. Then the front part of the spine is where the discs and the vertebral bodies themselves live. The anatomical structures such as your intestines, your liver, kidneys, spleen, those are all about right here. And so the discs and the vertebral bodies actually live very close to them, live right behind them. The vertebral bodies that we refer to are here. There's 5 of them. There's 1, 2, 3, 4, 5. This part of the spine is the beginning of the tailbone, which is called the sacrum. The discs are the cushions between each vertebral body. So this is L1, L2, L2, L3, L3, L4, L4, L5, L5, S1. The next thing we want to look at is the junction between the bones, and those are called the facet joints. And if we look to the side, we can see these structures that allow you to flex back and forth. These are called facet joints. It's F-A-C-E-T. The next thing we want to look at is, where is the spinal cord? The spinal cord itself typically stops about here at about T12 to L1 for most people. It then turns into individual nerve roots that are within a tube. My best analogy to think about that is think of a water balloon. And with a long water balloon, one end of that water balloon has a sausage in it. The other end of the water balloon has spaghetti. The sausage end is in your cervical and in your thoracic spine, and that is the actual spinal cord itself. The individual nerve roots are like the spaghetti, and they are inside the water balloon. Then those individual strands of spaghetti come out the sides of the spine, and they go down your legs. They can go to the front of the thighs, the buttock, the back of the thighs, but all the way down to your feet. So when the question arises, do I have a pinched nerve in my back? The question is whether are we having pain in the center of our back or just off midline? That typically is not a pinched nerve. A pinched nerve, meaning one of these pieces of spaghetti that runs down the leg, the people will get radiating pain down into the buttock, the back of the thigh, front of the thigh, or even down to the foot. That's how you tell the difference between a pinched nerve and not a pinched nerve in the low back.